So welcome to my station. This is Dr. Emmanuel. I want us to look at something that sometimes, new GP trainees, sometimes get confused on how to do their clinical case reviews. So in our previous video, we shared some tips, on, just an overview of what the 14 fish portfolio entries are like and the requirements for each section of your training. That's each year of your, of your training out of your 3 years. And we saw that clinical case reviews in your ST1 and ST2 in each year, you need to do 36 clinical case reviews. And sometimes we, GP trainees find this quite daunting. And, we just need someone to tell us or to guide us on how we should approach these clinical case reviews. So when you click on your portfolio, you log into your portfolio and you want to put in a clinical case review, a new clinical case review, this is what you see. Okay, you see the title box and you have to put in the title of what the case you want to talk about. So it could be a case of maybe depression. You could say an elderly patient with depression, or you could say a young lady with headache and galactorrhea or something. You just put a title there, and then you choose the date. And then you select where you saw that patient. If you saw the patient at the GP surgery, you put that there. Or if it was a telephone triage, if it was a video consultation, remote telephone consultation, a home visit, if it was when you did your out of hours GP work, or if it was during your hospital placement or any other place you saw this patient, maybe in a hospice or something, you put order and then you specify. Then you move next to the next box, which is a brief description. So in this brief description, as you've been told, make it brief. States what you've done, maybe the age of the patient. If I attended to a 55-year-old lady in A&E who presented with maybe shortness of breath and chest pain of sudden onset, whatever it was. Talk about briefly the history, briefly your examination findings, if she was stable, if she was unstable, whatever you did in your plan, investigations, if all investigations were normal, if any investigation was abnormal, you briefly mention that, and then you briefly mention what you did. Also talk about, just mention if you spoke with the consultant or the registrar, or if you spoke with the medical registrar on call or surgical registrar or wherever, orthopedic registrar. If you did that, if you discharged the patient, if you did a safety net, if you admitted the patient, so briefly describe what happened, what transpired. And after describing that, we'll move over to the next place where you have to select 2 clinical experience groups. So not more than 2 for each clinical case review. You can't choose more than 2 clinical experience groups. And in our previous video on the 14 fish, we talked about what the clinical experience groups, we just mentioned them. They're on your portfolio, so it's not something that is hidden. It's right there in your portfolio. You select from the 9 clinical experience groups, okay? There are 9 clinical experience groups, like children, people young adults less than 19, maybe mental health, female, gender and sexual health, maybe unscheduled, urgent and unscheduled care, like in A&E, so you choose whatever clinical experience group. If it's a safeguarding thing, whatever it was, you choose that group, okay? Then you move down to your capabilities that this entry provides evidence for. And you can see here maximum of 3. So you can choose 1 or 2 or 3, but most times if you're going to do, or advise, if you're going to spend the time and effort to do a clinical case review, you should as well, maximize that, that effort by selecting 3 capabilities. Okay, so try to always select 3 capabilities for every entry. And we looked at the 13 capabilities, that you can select from. And after doing that, you have to go to reflection and learning needs. So under reflection, it's written here, what will I maintain? improve, or stop. So when it comes to reflection, I would say do your reflection, based on the style of your educational supervisor, because different educational supervisors will tell you different things when it comes to reflection. Some educational supervisors will be very happy with you just writing, outlining what I'll maintain, what I'll improve, or what I'll stop. Okay, without you talking about how you felt, while you were assessing this patient. So you just go straight to the point, hit the nail on the head. So, okay, when I saw this patient, this happened. I want to improve on this. I want to improve on that. So I would like to continue doing this. I would like to continue doing that. But some want you, most supervisors, I think, will want you to talk about how you felt. So maybe that was the first time you were managing a child with acute severe asthma. You're like, okay, fine. I wasn't very comfortable because I've not previously managed, a child with acute severe asthma. And this child was, severely short on breath. I panicked within me, but then obviously I had to do a quick assessment, and you had to involve my registrar as quickly as possible. We apply the guidelines, A&E, trust guidelines. So say how you felt. If you felt on the edge, if you felt uneasy, if you felt a bit unsure of what to do, mention that. Mention how you were able to manage that fear or that doubt, okay, and how that's proper management ensured that the patient was safe and had a good outcome. And then you're now going to say, okay, now you've got more experience, now you've got an experience, you would like to read more about this, and you think that subsequently you will be able to be more confident in addressing or managing children with acute severe asthma. Okay, so I think personally I would have preferred if reflection and learning needs were just put in one box, because I think they're just tied together. Okay, your learning need can just be easily tied to your reflection. So I would have personally preferred if it was just one box, but now it's split into two boxes. So put your reflection, how you felt, you know, what you think you learned, what you think you learned from attending to that patient, from applying the guidelines, from speaking to your registrar or the consultant, what you learned and how you would, use this in future, patient management. And the learning needs identified from this event. Personally, I find learning needs to be the most irksome or, part of the portfolio, because I'm like, oh yeah, I mustn't always learn from every case I choose to reflect on. I could just have seen something I felt is quite interesting. It may actually be buttressing the knowledge I already have. So it might not be an entirely new learning experience for me. So what I commonly do is when I get stuck, I just say, okay, yes, I would like to read more. Okay, I would like to read more. I would like to make out time to attend maybe the chest pain clinic or the asthma clinic to get more experience on how to manage, patients with acute severe asthma, pediatric patients with acute severe asthma. So you can say, okay, I'll try to make out time, maybe apply for study leave, spend 1 week in the asthma clinic to get more experience on this. So that can be a valid learning need if pediatric asthma was the clinical case, scenario. Private notes, I usually don't do private notes because you can always do private notes if you think you will still go back to read them. And then here you can attach pictures if you think they are necessary. Maybe chest X-ray. If there was something striking on the chest X-ray, you could attach a picture of the chest X-ray, but make sure no patient's identifiable information, patient's NHS number or patient's hospital number, patient's name, date of birth, biodata essentially are not included in that image. You can attach them there. So this is just one of the clinical case reviews I did was it last year? Yeah, early last year during my first rotation, which was in A&E. So this is not even the best of, clinical case reviews because I was a novice. I was barely few weeks into my first GP placement in A&E. I was a complete novice. I've never used 14 fish before, and my previous, medical training, we're not really reflective kind of training. They were majorly logbook based. So this was completely new to me. But then I'll just show you what I did, okay? So this was the topic. I chose foreign body injection in a child. Okay, so I chose the topic foreign body injection in a child, okay? And what I did, so setting of case review was in the hospital. So this was in April last year. So barely 2 months into my training. So hospital setting, so brief description, what I did, I gave a very brief history, very brief physical examination finding, and the plan, which was the investigation and treatment. So I said in the A&E, I had attended to a 6-year-old girl who was brought in by her mom. Her mom said she had just got out of the bathroom when the patient approached the mom, and said her younger brother had just made her swallow a 20 pence coin about 2 hours prior to when I saw them. So I asked the mom if she was certain it was a 20p coin and not a bottom battery, because I was more concerned if this child had swallowed a bottom battery. And she was quite affirmative it was a coin. The patient had remained fine since after the injection. She had no throat or chest pain. So I tried to roll out some red flags. She had no nausea or vomiting, no shortness of breath, no abdominal pain. Then I wrote the brief examination. Examination, she appeared calm and cheerful. She had equal chest expansion, normal breath sounds, abdomen was soft and all that. I just tried to make sure the child had not aspirated whatever she swallowed in quotes. It hadn't got into her airway, which obviously I wasn't suspecting. So I went through the NICE guidelines on foreign body injection in children and reviewed this with the consultant on duty. We agreed to get a chest x-ray, which didn't show any foreign body in the airway, lung, stomach. With this, we inferred that it had gone through the stomach and was likely going to be passed in her stool. So the guidelines said parents should not be advised to look for the foreign body in stool, which I told the mom. So the NICE guideline says parents should actually not bother looking. As long as the child remains fine, you don't need to bother scooping, through looking through the stool. So I attached an image of the NICE guideline on pediatric foreign body injection, how it's managed. So I attached that because I made reference to that guideline, while managing this patient with the consultant. Then clinical experience groups, I chose infant, children, and young people because, of course, this was a child. And then urgent and unscheduled care because, of course, this was A&E. It was an urgent, situation. So I chose those two as my clinical experience groups. And then capabilities, I chose communication and consultation skills. And so when assessing the child, I asked the mom. So I was able to, of course, I communicated with both the child and the mom. I took a history, so I chose communication and consultation skills. I also chose practicing holistically, promoting health and safeguarding, because this was a child, who had purportedly swallowed something. So we needed to make sure this child was safe at home, was being properly looked after by the parents. I mean, we're like, okay, fine. If this child was left alone, mom went to have a bath. This is something that happens normally, isn't it? But we just needed to think and ask ourselves, hope we're happy to send this child home, okay, without raising any safeguarding concerns. And there was no safeguarding concern at that point, okay? But we just needed to ask ourselves, should we be worried? So I chose that, practicing holistically, promoting health and safeguarding, maintaining performance, learning and teaching. So of course, I spoke with my consultant. I gained more knowledge by discussing this case with my consultant, and also by making reference to the NICE guideline. So I had to also choose maintaining knowledge because I had learned more, I had improved my knowledge base. So I've just hidden what my supervisor wrote because I've not gained his consent. I've not gotten permission from him to share his own input on my portfolio. So I've just screened it out. Okay, so this is just the end of clinical case reviews. Okay, how to do a clinical case review in your portfolio. This is not the best, and this is not close to being the best form of reflection, but this is just a guide, to help someone who may be a bit confused as to how to approach doing a clinical case review in your 14 fish portfolio. I hope this has been helpful. Thanks for your audience. Cheers.